ultimately you want to still prevent further falls. So you need to modify the medications which might be responsible. You need to take care of the correctables, take care of the vision, take care of the hearing. If they are not able to walk properly, get a detailed, I mean, after I do a detailed fall risk assessment, I obviously, if needed, the physiotherapy is involved. If it's a balance problem, get the balance corrected, get the footwear corrected. Then if needed, whether they need an assistive device, whether they need a walker or whether they need a stick, that also should be corrected. Then the thing with the assistive devices, we need to see whether they are walking with the device or they are making the device walk, because a lot of times they use it wrong. So that's also to be checked. Not prescribing the assistive device, not alone, it's not the one which is enough. You need to see whether they're doing it properly. It can't be too high, it can't be too low, because there is something known as a distance between. It can't be like crooked like this, so how will they actually use it? So it has to be properly so that they can easily sort of use it. Then of course, depending upon the cause, after the fall has happened, depending on the cause, invariably people end up having fractures. So bone health is very important. Take care of the osteoporosis part, vitamin D, calcium. Then, if at all needed, other agents can also be given through injection or oral. Then another important thing is to make sure that whatever fracture has happened, if it is repairable, then immediately the door to needle time that they say, once a hip fracture happens, they should be immediately operated, because the more the time, more there's a chance of deformity, more there's a chance of embolism. So all those things, risk factors are really there. So that's why orthogeriatrics is also very important, wherein a geriatrician and orthopedician try to work together in making sure that an older adult gets properly, I mean, the surgery is done and pre and post surgery is taken care of. Then weight loss is important. Sometimes a person being obese, people might say when they fall, there is a lesser chance that the hip might break. But because of being top heavy, there is also a greater chance that the balance will also go. So all the correctables are the ones which I try to focus. Medications are very notorious and very easily can be modified. So these are the things. Fluids, the amount of water they are taking, neither too much, neither too less. So all those things are the ones usually which we need to sort of correct. Once a fall has happened, it can lead to mortality, it can lead to morbidity, a lot of financial costs. A person might be bedridden. Even after the surgery is done, the job is not over. The person has to get the confidence back. So I try to work on the confidence also. And the fear of fall, you have to work on the mental makeup only, because that is no other way. Try to make them walk in front of you with the help of a physiotherapist if needed. Try to give them a bit of balance. Once they get the confidence, then they will be able to walk properly. It is also important to know how the fall has happened, because a fall can happen many times. It can be a forward fall, backward fall, side fall, fall because of a slip, fall because of maybe some obstacle was there. Is it because of the fall on their own urine? Is it because of the surface? Is it because of their footwear? How they fell? These are all. What were they doing at that time? What part of the day it was? People can have a stroke and then fall. People can have a fall and then have stroke. So basically, what has caused? And another thing I wanted to highlight is rhythm disorders are very important, cardiac rhythm disorders. So they tend to also cause a lot of chances of fall, because that's why a lot of people might be on pacemakers, sick sinus syndrome, and even atrial fibrillation. All these things can be a risk for fall, especially because the rhythm is not okay. So there will be a great chance that there will be a lack of oxygen, and of course there might be a fall. So that is also very important as far as cardiovascular causes are concerned.